Hello, my name is Laura Mosqueda, and I'm delighted that we can show you what the next phase of your training could look like.
Keck School of Medicine, we pride ourselves on challenging paradigms and thinking outside of the box.
The amount of exposure that we get as students at LA County and Keck and all these different sites is incredible.
The training you get here is as hands-on as it could be.
Good morning, Mr. Reed. Oh, do you have the CT scan?
Yeah.
Let's pull up that CT scan.
So this is the CT scan from the first day.
We take on the toughest challenges, the toughest cases. We take on the biggest questions for research to try and make a difference and improve human health.
We are smack in the middle of it all, right here in this health sciences campus. So we have a county hospital right across the street that has incredible, not only inpatient, but ambulatory facilities. Right across the street in the other direction, we have our Keck hospital with wonderful ambulatory and outpatient surgery sorts of facilities. Then on my right, we have our Norris Comprehensive Cancer Hospital. And then just across the street, we have our major research buildings too.
This one is unique because it's for cranioplasty.
Research and education are really the foundations upon which everything else at the School of Medicine is founded on. You have multitudes of opportunities to do bench work, clinical research, translational research, and really take your work from the bench side to the bedside.
Hello. Hi, Lauren. How are you doing? I'm well, thanks.
This week, in fact, we've had a sickle cell patient, an aplastic anemia patient who came for treatment. We get TTP patients. We have 3 to 5 autologous stem cell transplant patients on at any given time.
I've been here 44 years, and there's 2 common foundational principles. Number 1, patient interest supersedes self-interest. This is absolutely critical.
Your levels are coming down, looking good. So you're thinking discharge?
Yeah, I think you can go home today.
The second is that this is a teaching center, and we talk about the very famous professors that are here to teach you. But the one thing everybody learns is that the master teachers are the patients themselves.
And so, sir, we're going to show you what you actually had before and after. Okay? This is what you came in. That's what you came in with. Nearly locked out that entire lung, right? Yeah. Oh my gosh.
You must have a passion. Part of your mission is to take care of the underserved. We are serving the underserved. We are serving those that are more socioeconomically advantaged. But essentially, you want to serve everyone and everybody and serve them the same, regardless of who they are.
So who's our next patient? In here?
Yeah.
Yes.
These are the patients that, it's not just a pleasure to serve, it's an honor to serve.
They're my people. I see myself reflected in the population.
I really wanted to come back home in more ways than one. This could be my mom, this could be my dad, this could be my uncle. And no other place could afford me that opportunity besides here.
It's been the most challenging and rewarding thing I've done in my life, being here. I've been pushed in ways that I didn't think were possible.
We're looking for that spark in a person that's going to become a good physician who's going to put the patient first.
Can we get Dr. Dix in here, please? Can we get some backup?
No matter how dramatic this scenario is, it's something that happens.
Patient just went non-responsive, her blood pressure dropped. We are pretty much in the ORs from day one. We do cases that other places just read about in textbooks.
You really want to care for the caregiver. Our goal is to prevent burnout before it even happens.
Takes about 8 months till you start thinking, I can do this, I can master this.
Do you see anything worrisome at all? Anything new?
No, I don't.
This is not a movie, this is for real.
Can you show us 2 fingers?
It's really important that not only do they listen to what the attending has to say, But equally important, the attending needs to listen to what the resident has to say.
Show me where your pain is.
We're here to learn. There's no dumb questions ever.
We really want an inclusive environment where you can be the thought and the change leader on our campus.
If you come to USC, you will be part of a close-knit, collaborative Trojan community.
It's so important to know that you're part of the Trojan family. That's not just a catchphrase here, it's something that we really mean. We care about the people who are here. We care about you after you leave. It's a lifelong commitment on our part.
Hi, my name is Ahmed Ibrahim. I am one of the pathologists at Keck Hospital, Department of Pathology. I am here today to talk about the GI and Liver Pathology Fellowship. So the fellowship it's a new fellowship. It's a one-year fellowship program. Keck Hospital Department of Pathology started this fellowship in 2019, and I got the honor to be the inaugural fellow in this fellowship. So the fellowship is basically it's structured to making the fellow to rotate in the two main campuses, which is the Keck Hospital and LIC USC Medical Center. And in Keck Hospital, of course, there is the fellow will be subjected to the variety of cases, and which has a lot of complexity, including the cases that people comes into Norris Cancer Center, which is part of Keck Health System. And of course, there is also a few months the fellow will rotate in LIC USC Medical Center. And also there, LIC USC has different sort of complexity and diversity of cases because they deal with different type of socioeconomic status and a kind of different diversity. So at Keck Hospital, there's a great opportunity for the fellow for continuous interaction with the clinical colleagues through multiple disciplinary meetings and tumor boards and clinical pathological correlation conferences. The faculty attendings there are terrific, and they are always there for their fellow, helping, and they always have their door open for any questions or for any difficulty that the fellow may encounter. Dr. Tatachev is the program director for the GI Liver Pathology Fellowship. He's very knowledgeable, and he has his own way and approach in formatting a concise and very informative pathology reports that can help our clinical colleagues and also can deliver best patient management. Among the attendings there is Dr. Gong. She's one of the young pathologists. She has a very unique way in approaching the cases, making the analysis and assessing the immunohistochemical stains and putting a differential diagnosis for the cases based on the recent research and updated approach. And also there we have also Dr. Chopra. She is one of the GI and soft tissue and cytopathologist and liver pathologist there. Every fellow rotates with her. She makes sure that he will be updated to the new research and the new clinical information. Also, I have to mention the chief of the anatomic pathology as Dr. Sherrod, because his door is always open for the fellows. The GI fellow will act as a junior attending, so this is it's very helpful that the chief of service to have his door open for any problem or for any encounter. I would love to also put an emphasis about the rotation at the LIC USC Medical Center, not only because the cases are diverse and complicated and has different sorts of makeup, but also because the fellow will get the opportunity to rotate with many experts there. Like, for example, Dr. Chandra Suma. He's one of the lead in GI experts who was well-known worldwide and nationwide. Also, Dr. Kanel, he is one of the experts in liver pathology. He's well-known liver pathologist in Southern California, and he makes sure that all his fellow will have the substance knowledge that they need in order to have the best diagnostic approach. I would best describe this fellowship as not a truly fellowship. It's basically a junior attending position, and it's a faculty fellow position. The fellow got the privilege to go through the credentialing process, and after the first 6 months of the fellowship, we'll get the privilege to start to act as a junior attending. The fellowship rotation is divided through multiple services, including GI service and liver service. The GI service basically is divided into two main services, which is GI biopsies and GI major resection specimens. Since Keck Hospital and Norris Cancer Center is part of Keck Hospital, so the fellow get the chance to encounter a lot of cases of pancreatic biliary diseases and complex Whipple specimens. And also Keck Hospital and Norris Cancer Center Medical Center is has a major transplant center. One of the medical services is the liver service, in which the fellow get encounter to deal with the medical liver cases, transplant cases, and also liver transection cases, which is either explant or tumor cases. At County Hospital, the fellow will get the chance to have teaching opportunities in which they will sit down with the other junior residents or a newly surgical pathology fellow, and they will try to also guide them through difficult GI cases. Also, there at County Hospital, other pathologists, and also their expertise comes from long time of service. I would love to bring name Dr. Yanling Ma and Dr. Narituku. They were actually also trained under Dr. Chandrasuma, and so you get the chance to train by the main master, Dr. Chandrasuma, and the masters, which is Dr. Yanling Ma and Dr. Narituku. I live close by, which is in Pasadena. It's about 20 minutes from here. Before coming to California, a lot of people, they were cautious, but for me to come over here because of the traffic. Me, with a lot of colleagues, we share the same kind of feelings that the traffic to the hospital, the traffic is very good, especially at early morning. And usually for the people who live close to the hospital, which is in LA or Pasadena, South Pasadena. The hospital is located in a very beautiful area where if we get to park into the rooftop at the USC Medical Center, we get the chance to look at the beautiful downtown during the morning, which looks like a postcard. And at night, it looks like it's a very glamorous city. And if we get the chance to park over at Keck Hospital, we will get the chance to see the beautiful mountains and the beautiful nature from there.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is, be assured that you are going to be the most well-prepared person possible for that next part of your career.